Hello everyone. Welcome to another episode of Bone Doctor. In today's episode, I'm going to discuss about chest injuries. That is, injury to the chest wall and the organs inside it. What happens when you encounter chest injuries? In this episode, I would like to discuss how the chest injuries occur and what are the consequences of it, and most importantly, what are the danger signs or the signs which you can notice, and if you see those signs, you should not ignore it and rush to the nearest hospital immediately. First of all, how does chest injuries occur? Most commonly, chest injuries occur due to direct trauma to the chest. That is, if you hit something by the chest. Most commonly, it occurs during a road traffic accident, a car accident, or a bike accident in which the passenger's chest is hit into the steering wheel or the bike's handle, or he is thrown off the bike and the passenger hits the road or a lamppost due to that velocity. This is one of the most common cause of chest injuries. Other modes are indirect injuries. That is, while lifting a heavy weight or while pushing a heavy object, the force which is applied to the arms is directly transferred to the chest. In other serious injuries, where there may be a bullet wound or a stab injury to the chest, which can also cause significant injuries to the chest. So these are the modes by which the chest wall and the organs inside the chest can be seriously injured. So let us discuss the effects of the chest injury layer by layer. We start from the outer layer, that is the skin and the subcutaneous tissue. Then we move on to the ribs, and then we move inside the vital organs inside the rib cage, that is the heart, lungs, the aorta, and inferiorly the liver and the spleen. When a minor chest injury has occurred, for suppose the amount of injury is on a lighter side, then the bones are not injured, the lungs or the heart or the internal organs which are involved are not injured, but it is the skin and the muscle beneath the skin which is injured. In such cases, you may notice a bruise or a swelling in the chest wall. There would be occasional pain during breathing or turning sides or doing specific work such as stooping forward or lifting a forward weight or heavy weight. This pain usually goes away by 15 to 20 days and the patient is healthy and there is no such complaints such as breathing difficulties or shortness of breath, etc. If the force applied is further greater than the previous one, then one can encounter rib fractures. We know there are 12 ribs on each side of the chest wall. These ribs are thin and they are constantly protected by the muscles which encompass these ribs from either side, from inner side and outer side. These are called intercostal muscles. So when the force is so much that these ribs and the muscles cannot take that force, there may be a fracture of these ribs. Rib fracture, if it is isolated, if one or two ribs are fractured and if there is no displacement in the fracture, then it is of not of much danger. But if multiple ribs are fractured and the ribs are displaced, then the broken ribs act as knives or spears inside the chest. It can cause tearing or puncture of the pleura, that is the layer which covers the lungs, and that may lead to pneumothorax. That is, air from the lungs may get inside the pleura, causing pneumothorax. Pneumothorax simply means air inside the thoracic cavity. We know as long as the air is inside the lungs, it is helpful for our breathing. But if the lung gets into the pleural cavity, then the air causes compression to the lungs and there is difficulty in the breathing. That is, the patient will suffer from shortness of breath. If there is injury to the arteries present in the rib cage and the wall, then the arteries will bleed and that will cause hemothorax, that is blood inside the pleural cavity. There may be combination also. There may be pneumohemothorax, that is a combination of blood and air inside the pleural cavity. All these combinations are life-threatening. This causes pressure to the lungs and the lungs cannot expand, thus it prevents normal breathing of the patient. So it is an emergency and that amount of air or blood in the pleural cavity needs to be drained immediately. If multiple ribs are broken, it may lead to flail chest. That is, the chest wall moves abnormally, preventing normal breathing of the lungs. That is, the lungs cannot expand and contract properly, preventing breathing of the patient. There may be surgical emphysema. That is, the air from the lungs may get into the subcutaneous tissue of the skin, causing swelling of the skin around the chest. This also prevents breathing. The lungs may be punctured due to the broken ribs, and that may cause complete collapse of one or both lungs, causing an acute emergency which needs immediate attention and immediate treatment. If the heart is injured due to the blunt trauma, then the pericardium or the cover, the lining of the heart may bleed, causing cardiac tamponade. That is, the blood may accumulate in the pericardium and it may cause pressure to the myocardium, that is the heart muscles, and the heart muscles cannot pump properly. This may cause malfunctioning of the heart, that is the pumping capacity of the heart may decrease and it may cause cardiac failure. Heart pericardium can be injured, the myocardium can be injured, causing damage to the muscle or rupture of the heart muscles. The big artery, that is the aorta, which comes out from the heart, from which the blood is pumped through the whole body, may be ruptured due to the injury, and that may cause bleeding inside the chest wall cavity. These are very grave consequences of chest wall injuries and they need immediate attention to save the life of the patient. There are other two important organs which lies just in the margin, in the lower margin of the right chest wall and the left chest wall, that is the liver and the spleen. Both are very vascular organs. That means they are very important and they are full of blood. If the spleen is injured due to injury to the lower part of the left side of the chest, it may cause huge amount of bleeding, splenic rupture, which may cause immediate death of the patient. If the liver is ruptured, which is present on the right lower side of the rib cage, that may also cause severe bleeding and immediate shock of the patient. So these are grave consequences of chest injuries. So let us now summarize and understand what are the symptoms which you will look for in a patient of chest injury, in which you will be alarmed and you should take immediate steps to take the patient to the nearest doctor or the hospital. First of all is the amount of pain the patient is having. If the pain is severe and the patient cannot breathe properly, then you must suspect a rib fracture or an internal organ injury. You should look for signs of bleeding inside the chest wall. If there is a huge bruise or bluish discoloration in the skin of the chest, then that means there is either a hemothorax or a rib fracture through which it is bleeding, or the lungs have ruptured, etc. The patient is unable to breathe if he has shortness of breath, if he complains that he cannot take air properly, or it's painful for him to breathe in air, that means the lungs are affected and it needs immediate medical attention. If the patient coughs out blood, that means lungs are affected, lungs are injured, and there is blood in the trachea, which is a grave emergency. So if these symptoms are encountered, then the patient needs immediate medical attention. On the contrary, if there is off and on chest pain which is relieved on rest and the patient can breathe properly, there is no signs of any bruise, the muscles and the skin around the injured area is tender, but it is not, it doesn't feel to be broken, and the patient can breathe normally, then these chest injuries need to be treated, but these are not urgent emergencies. Immediately what you can do is you can apply a piece of cloth, if it is available, or a chest belt around the injured area. Chest belt prevents excessive movement of the chest wall and thus prevents and reduces the pain of the patient. You may apply hot compress, give analgesics, and ask the patient to move as little as possible, because movement can increase his pain. After the patient is stabilized, the patient may be taken to a doctor where you can get the x-rays done and doctor can comment if there is any fracture or not. Most of the patients in chest injuries are treated with medicines and a rib belt, and they get well by around 1 and 1.5 months of time. Even if there is a small rib fracture involving 1 or 2 ribs, if it is undisplaced, there no surgical intervention is required, and just a rib belt and taking rest and analgesics and calcium gives good healing of this patient. So these are the things which I would like to convey about chest injuries. If you have liked this content, please give it a like and do share the video, and if you like my channel, please subscribe. That's all for now. Bye bye.